Hello, my name is Christian Romero. I'm going to be your provider for today. If you have any questions or you feel uncomfortable during the exam, please let me know. Before we begin, we're going to be uploading this video to YouTube. I'm going to be recording it and using it as academic purposes in YouTube. Do you consent?
I consent for this video to be uploaded on YouTube for academic purposes.
All right. Can you please tell me your full name and date of birth?
Tanya Romero, 11-15-82.
Okay. So when I'm talking to my patient, I'm actually inspectioning her sclera, checking for any jaundice that she might have. Jaundice can be indicative of liver cirrhosis and also her skin. So I'm going to have my patient lay down comfortably, relaxing her abdominal muscles. Then I'm going to be uncovering her abdomen. So I'm checking the contour of the abdomen, any peristalsis. Her abdomen is soft, round. I can actually visualize softness. So the abdomen looks round. Like I said, there's no peristalsis. I'm also checking for jaundice or any discoloration of the abdomen, any pulsations. Now I'm going to proceed with auscultation. So I'm going to begin with the right lower quadrant, right upper, and left lower. There's three types of sounds: active vowel sounds or normal active sounds, hypoactive and hyperactive. So active is pretty much normal. Hyperactive might be indicative of the patient having gastrointestinal upset like diarrhea, dumping syndrome. Hypoactive can be indicative of bowel obstruction, for example. So now I'm going to be listening for the vowel sounds. So the patient has active vowel sounds on 4 abdominal quadrants. Now I'm going to proceed with listening or auscultating the aorta. So I'm going to have the aorta, renal, iliac, and then femoral, the lower. So I'm going to be checking for any bruise or anything abnormal. So now I'm auscultating the aorta, renal, and I'm going to check bilateral. Same thing with iliac. And then the femoral will be near the inguinal area, but I don't want to expose my patient, so I would auscultate on both sides. All right, so pulses are +2, bilateral. Now I'm going to proceed with percussion. So I'm going to percuss with my left non-dominant hand, middle finger, and then with my other hand, with the middle finger. So the abdomen should be heard as tympany. If there's any dullness, might be indicative of the patient having any, like a mass, for example, or percussing an organ. Also, we're going to be checking her bladder, urinary bladder, to see if there's any urine inside the bladder. If you percuss and you hear dullness, the patient will have urine in the bladder. If it's tympany, there's nothing inside. so I can hear tympani. You don't feel the urge to go to the restroom? Okay. Now I'm gonna be percussing her to measure the liver. So the normal values for the liver, it's 6 to 12 on a normal patient. If it's higher than that, patient might be having like liver cirrhosis, for example. So I'm gonna start on the right lower quadrant. I'm gonna be percussing upward until I convert from tympani to dullness. If you can relax more. So I'm gonna make a mark, and then I'm gonna go from up, like mid-clavicular area, and down. In here, I'm gonna hear resonance. So once I hear from resonance to dullness, then I'm gonna make my mark. Okay. Now I'm gonna measure. So centimeters. So my patient is about 6.4, which is normal. Then I'm gonna proceed to the other side to check the spleen. So pretty much the spleen, I'm gonna start from the upper portion, but it's gonna be on the left anterior axillary region and down. If the patient, if I can hear from tympani to dullness, that's something abnormal. So we shouldn't be hearing any dullness when we're checking for the spleen. Go ahead and take a deep breath. All right. So I couldn't hear any change of sounds. So the patient is the spleen. It's pretty much normal. So now I'm going to proceed with palpation. So we're going to be starting with light palpation and then go to deep palpation. So from light palpation, I'm going to start palpating my way around the quadrants. Any pain?
No.
So I'm checking for any tenderness. Now I'm going to go deep palpation. Any pain?
No.
And when I'm pressing on the abdomen, I'm checking my patient's face to see if there's any grimace or any guarding or any pain being reflected on the body. So now I'm going to see if I can palpate the liver. So I'm going to have the coastal vertebral region. I'm going to have my patient take a deep breath. Go ahead. Exhale. So I'm able to palpate the liver about 1 centimeter. Then I'm going to do the same thing with the spleen. Go ahead and take a deep breath. Ticklish?
Yes.
So I'm unable to feel the spleen. Now I'm going to be performing some special tests. So to check for cholestasis or pretty much gallbladder issue, I'm going to be pressing with both hands upwards, and then I'm going to have my patient take a deep breath. Any pain? Okay, exhale. So if it's a positive Murphy sign, when the patient is taking a deep breath and I'm palpating inside, she's gonna reflect pain. There's a couple of tests to be done for the appendix. So it's one of them. It's the rebound tenderness. So I'm gonna palpate down. I'm gonna ask the patient if the pain is higher in intensity when I press or when I release.
Press.
Okay. So if the patient might be having appendicitis, the patient might be if the patient has appendicitis, when I'm releasing, she'll have higher pain than when I'm pressing down. Another test could be the obturator test. So I'm gonna have my patient flex like this, and then try to force up when I'm pushing down, okay? Any pain?
No.
Now relax this arm, this leg, now the other leg. Flex like this, push up, okay. So if the patient have appendicitis, the patient will be complaining of pain when she's fighting against my force of me pushing down. So now I'm gonna be doing the fluid test. So the fluid test, I'm gonna have my patient participate in this. So I'm gonna have you put your hand kind of like this, more lower, there you go. I'm gonna have one hand on one side, the other one on the other side. So I'm gonna hit a little bit and see if I can feel any fluid going to the other hand. Patients that are positive for the fluid test, there you go. So the patients that have a positive for fluid test could be a patient with cirrhosis that have ascites, and then you can actually feel the wave coming to the other hand. Any questions?
Everything's okay?
Yeah, so everything is fine. And I'm gonna be doing special soap notes, and then my professor is gonna see it. Okay.
Okay.
All right. Thank you.
Thank you.